Hello, everyone. My name is Joe Baal. I am a first-year radiology resident at the University of California, San Francisco. Today, I'll be presenting our project entitled Magnetic Resonance Focused Ultrasound for Painful Bone Metastasis, a pooled meta-analysis of 33 studies with 1,082 patients. Every year, there's an increasing number of patients living with advanced cancer, and the bone is the third most frequent site for metastatic cancer. Painful bone metastasis is the most common cause for cancer-related pain. And given that these patients with bone metastasis have a median survival of just half a year to 4 years, there's a strong focus on the improvement of quality of life in these patients through palliative treatments. The current standard local therapy for painful bone metastasis is radiotherapy, which can achieve about 60 to 70% treatment response rate. However, it's associated with radiation-induced side effects, and the number of radiotherapy sessions that can be done is also limited by the radiation dose limits of the targeted bone and soft tissue, which is a significant limitation, especially for patients with known radio-resistant primary cancers, which likely will need multiple sessions of radiotherapy. In recent years, there's been multiple studies highlighting HIFU or MR-guided focused ultrasound as a safe and efficacious treatment for painful bone metastasis. Through MR guidance, it's able to delineate soft tissues, and through real-time thermal mapping, it's able to monitor and safely deliver just the right amount of energy without causing collateral damage. It's also safely repeatable since no radiation is involved. However, many of the studies that look into this have been limited by small sample sizes. The purpose of our study was then to evaluate the safety and efficacy of HIFU in the treatment of painful bone metastasis through a systematic review and meta-analysis of the current literature. The safety was assessed through the number of post-treatment complications, and the efficacy was assessed through the pain scores before and after HIFU treatment. To be included in the analysis, a study must have clinical outcome and or toxicity data and must have at least 5 or more patients. Studies were excluded if they did not have clinical or toxicity data, had less than 5 patients, had less than one month follow-up, had redundant patient cohorts, or if they were not primary research articles. Through our search in PubMed and Embase, our initial search yielded around 1,300 articles, which was then cut down systematically to a final 33 studies, which involved 1,082 patients. A pooled analysis was then done on the study-weighted proportion of patients that were able to achieve treatment response. Treatment response was defined as an at least 2-point reduction in the pain score before and after the HIFU treatment. And overall, there was a 79% treatment response rate in the group. In addition, there was a mean difference in the pain score of a negative 3.8 at 1 month follow-up compared to baseline, and negative 4.4 at 3 month follow-up compared to baseline. A subset of the group had prior radiotherapy, and this group showed a 74% treatment response. In terms of safety, there was less than 1% high-grade toxicity and around 6% low-grade toxicity rates. And about 12% of the group experienced a transient sonication-related pain during the HIFU treatment. In conclusion, our study highlighted HIFU as a highly efficacious and relatively safe palliative treatment option for symptomatic bone metastasis, with treatment response rates that rival the current standard radiotherapy, our study offers the notion that HIFU is a viable first option alternative for symptomatic bone metastasis, especially for patients with radio-resistant primary cancer types. At minimum, it is a very realistic salvage therapy option for those that fail initial radiotherapy treatments. With all that said, our study was limited by the heterogeneity of the studies included, and the majority of the studies included was also limited to a 3-month follow-up. So more long-term follow-up studies are needed to understand the long-term effects of HIFU. These are my references, and thank you for your time.